It's the morning of April 4th, 2018, and all of a sudden I put the camera on and it started to pour a little louder out there. It's a rainy day in the North Country. Temperatures are going to go up and then go down. We're here to talk about a relatively brand new doctor here at the, I got to keep remembering to get all the words in the right place here. Hudson Headwaters Health Network, Champlain Family Health Center.
Correct.
And this is Dr. Samantha, is it?
Correct.
Harris?
Yes.
All right. And you've been here how long, Dr. Harris?
Since the first week of January.
Oh, so it's
Pretty new.
Yeah, 3 months plus here.
Right.
You're starting your 4th month. And you are a podiatrist.
Correct.
Now my camera's sitting on a tripod, and that tripod and podiatrists have a common little theme there. So tell us what a podiatrist is, if you don't mind.
So a podiatrist is a specialist of the foot, and we provide surgical services for foot disorders such as bunions, hammer toes, tendon injuries, fractures. We also provide conservative management of those above disorders, as well as ingrown toenails, fungal toenails, any basic disorder, skin disorder of the foot, we provide those services for.
Okay. And how long have you been practicing?
I finished residency in 2013 in Toledo, Ohio. So that's when I entered the practice of podiatric surgery.
Okay. So I'm sure you don't just do surgery. If somebody comes in doesn't need surgery, they'll still see you, right?
Correct.
Yeah.
Yes. My background prior to becoming a podiatrist, I was a physical therapist. I'll always be a physical therapist. I shouldn't say was. But I specialize in orthopedic physical therapy. So my conservative management of lower extremity disorders goes beyond podiatric surgery and podiatry with my physical therapy background. So that makes me a little unique in the area of podiatry, that I've had such a significant orthopedic background as well.
Okay. And speaking of background, where are you from originally?
Grew up in Nashville, Tennessee. The reason why I talk so funny. I went to podiatric medical school in Cleveland, Ohio, and then trained in Toledo for surgical residency, and have been practicing in the New England area since 2014, and then moved here from Vermont, started here this past January.
Okay. So is your family still in Tennessee?
Yes, yes. My significant other is from the New York area, which, is why the opportunity came up to move here for us to be closer together, as well as I like practicing in a rural area. I find it much more rewarding, and I just love the rural aspect of medicine as well as the lifestyle.
Okay, so obviously Nashville's not very rural. We think of Tennessee as being rural, but
Correct. Nashville's a very large city, yes.
And so you grew up around all that Grand Ole Opry stuff, and
Right, right.
it shaped you into who you are today.
Exactly, exactly.
Okay, now I have to wonder if there's enough to keep you busy here with. And you said it's a rural area. And
Right.
so I would assume that you're not just taking patients that come here to the North Country, former North Country, the Champlain Family Health Center. People could refer you from other doctors in the area
Correct.
too, right?
Correct.
Is that the plan?
Correct. I take self-referrals as well as patients that are not established with the Champlain Family Health as well. So I take, referrals from other physicians as well as self-referrals.
Okay, so if somebody's got a bunion and they say, I need to see a podiatrist, they haven't got to go through seeing Dr. Surkevich
Correct.
or anything like that. They can just call here and
Yes.
get an appointment to see you.
Yes.
All right. Are there many podiatrists in the Clinton County area?
There are a few in the Plattsburgh area, but it's a very unique field that is in high demand due to the population of diabetics and very common foot disorders as well. So it's a good field. It's got a lot of patients that fulfill the need here.
Okay, so we've been keeping you busy then.
Exactly.
Oh, that's good. That's good. So, but podiatry is only from the ankle down. Is that
Correct.
basically what? So if it's something in
Correct.
your shins, they won't see you.
Depending on the diagnosis, I mean, it can be complicated when it comes to issues like that, but lower leg issues can stem from the foot as well, just due to the anatomy. So it's being screened by a podiatrist is, something that may need to be done because depending on where the complaint is. So it's because the anatomy of the foot comes from the lower leg. So, podiatry is something that could be considered for an issue like that.
Okay. Now I imagine there are certain seasons, like I can think of soccer season or football season that you get busier.
Exactly. Winter, we get very busy just due to what I call rubber boot syndrome, because the rubber boots, not being the most supportive shoes that we have, get lots of heel pain, toe pain, things like that. And then when spring and summer arrive, you get the weekend warrior that gets off the couch and goes to the field and has these acute injuries just due to deconditioning. So each season has its unique injuries, I guess.
Okay. Okay, you say you like the rural life. Mind if I ask you which town you're living in? I don't need to know your exact address. But
at this point, we're living in Rouse's Point.
Oh, I've been there.
Yeah.
I've passed through there many times.
Nice area, yes.
I hope you're not too far from the lake then, right?
Oh, no, not too far. Next year, I hope to get out there and start some ice fishing. That'll be a unique experience for me, but didn't get out there this year, but it looks interesting. So.
Yeah, so just be careful.
Yes, yes.
I don't know if we lost anybody this year. Usually every year we lose a few people that just think it's too early. They think it's early enough, or they think there's still ice out there when there isn't. But
Right.
I know we've had some people that have gone through, but I don't think we've lost any lives this year. But somewhere, usually in Lake Champlain, there's a
Right.
So be careful when you're out there.
Right, right.
And didn't have the opportunity to cross over the bridge this year during the peak ice fishing time, but normally when ice fishing is at its peak there and you cross over into the Alberg side, and there's just a swarm of people out there. And
Right.
I remember hearing a story of a truck driver driving through and stopping at the gas station there on the other side in Alberg and saying, "What are all those people doing out in that field?"
Right, right.
Because he just thought it was people sitting out there in the
That's
field.
something I would probably say if I hadn't known it was actually a lake. Yeah.
You probably didn't do any ice fishing in Tennessee.
No, does not get anywhere near as cold. Yeah.
Do you fish?
I do a little bit. I've been trout fishing a few times, which I want to continue doing that here. But when I lived in Tennessee, I was an avid hiker. So obviously there's plenty of places here to do that. So I do love the outdoors. So this spring, actually now, can start trout fishing. So we'll be doing that.
Oh, well, good. Good. What should people do if they decide that they, obviously, if one of the doctors here or one of the providers here, there's more than just doctors here that provide the medical services, if they'll obviously refer people to you if need arises, but the person out there who hasn't been referred, what should they do?
If they feel they want to see a podiatrist for whatever reason, if it's for a concern that they have or something they don't know that they have, if they, just are diabetic or have never seen a podiatrist before, they can call Champlain Family Health and discuss scheduling an appointment, or they can discuss it with their primary care doctor if they have an appointment that's coming up, and they can mention that as well.
Okay, 2691, I think, 518-298-2691.
Yes.
Yeah, you don't call here very often. So
No, I
you haven't
don't,
got it
sorry.
memorized. Okay, well, you mentioned diabetic a couple of times. What problems do diabetic people have specifically?
Well, when it comes to diabetes, there is a team approach for education and prevention. So obviously the diabetic, their main physician that controls their diabetes being their primary care physician. The team approach is podiatry as well as their eye doctor that they need to see at least once a year. My objective in that team is education and prevention for symptoms of neuropathy, which can be numbness, tingling, pins and needles, to prevent any type of foot injury such as a diabetic foot wound. So again, lots of education, lots of prevention for that. So I'm just part of the team when it comes to the diabetic management.
Yeah, I think we all know people who had diabetes and ended up losing, part of a foot and part of a leg, and it's just a very sad thing when
Right.
it advances to that. And of course, we've got the wound center. I think that kind of helps along with these lines for diabetics up at the, I call it the Hannaford area up at the CVPH. And we've got that wound center. So you've pretty much acclimated yourself to the area at this point in time?
I'm trying, yes.
You're
I
trying.
guess I could say that I was broken in pretty well in Cleveland, Ohio in the winters. Then of course Vermont continued that. So, it's a lifestyle. So it's now the mud season has started, so that's got me excited.
Well, we've kind of, as far as snow goes, we've lucked out a little bit here. I know 2 days ago the Yankee home opener was snowed out, so
Right.
We've had a lot of snow to come in the Boston area and the New York area. That some of it came up here, but most of it didn't
Right.
impact us the way it did them. So,
Right.
So it could have been worse. Let me say that to you.
Oh, exactly. Exactly. My last winter in Cleveland, we got a heavy snow that came through on April 14th, and that was a huge adjustment for me because I've never seen snow in April, prior to that. So that was big.
Well, I won't guarantee that we won't have any
Right.
accumulation here. In fact, I recently put on to digress a little bit, a softball game on my website, and April 22nd, the baseball game was about the third or fourth inning, and it was snowed out. All of a sudden, the big fluffy flakes came. Next day, it was all gone, but it was still April 22nd. We don't think of that happening, but
Right.
it does happen.
Oh, yeah. Yeah.
So hopefully not this year. So anything else, Dr. Samantha Harris, that we should know about?
I think we've done a great job hitting the services that I provide, and like I said, just excuse the funny talk and accents, and I promise to talk slow. So.
Okay. So all the way from Nashville, Tennessee, we've got Dr. Samantha Harris, the new podiatrist here at the Champlain Health Center, and I don't wish ill will on people, but let's hope we can keep her busy here.
Yes, thank you very much.
All right, thanks for chatting with us.
Thank you.